And rescue we are going to see in this class. This is the situation when an accident occurs. The healthcare worker has to reach the place and rescue the patient from the vehicle and take the patient to a safe place and give treatment and take the patient to a safe hospital. All operations include 7 basic steps. We have to form a mental picture or a plan how to rescue the patient from the vehicle that is collapsed. First, for everything we have to do the scene size up. We have to think what are the risky things present in the vehicle, and we have to make a size up, that is include think through the steps, decide what you are going to do first. When you arrive, avoid being caught up in the situation. The rescuer should not got caught up in the accident, the vehicle or unsafe scene. First we have to do the size up. It contains the survey, how many casualties, this and all we have to see before going to help the patient. Next, safety. Are there potential hazards to you or bystander at risk? Is the patient in danger? Rescuers who become being victims cannot help the patient. Instead, they need help. Outside help is additional assistance needed. If you need something, call for it, stay ahead. If you routinely work with other agencies, have plan of operation worked out in advance, that is police or fire. Their help also we can take in the scene. Significant informations we have to collect from the scene or what kind of vehicle, how many injured, what kind of collision, how many patients, any potential for hazardous material, anyone went away into the field and fall down or that and all we have to see. Sometimes the patient get out of the accident spot and go into the field and fall down. So we have to see around the scene, and mainly any hazardous material. If petrol is leaking or any acid content is leaking, we have to see it first, then go for the help. Next, hazard control. Traffic. We have to park on the side of highway as collision. The side of the collision itself, we have to park the vehicle without blocking the road. We have to park our vehicle on the side of the accident itself, and keep signals, visual signals to drive as well in advance reaching the scene, because sometimes other vehicles may come in high speed and collide with the accidented vehicle. Power lines. Next, we have to see for the power lines. If the vehicle got accident by hitting the pole or electrocuted tree, we have to see for power lines, whether it is whether electricity is passing through the vehicle. We have to check it. Then we have to give the board, electricity board, to stop the current. Then only we can reach the place. Next, gasoline or fuel spillage, we have to see whether it is leaking. In autos and all, immediately the petrol will leak off, opening the lock. So we have to see for a leakage of petrol or diesel. So while helping, we have to take care of our safety also first, then the bystander safety, and then only we have to see for go and help the patient. We should not risk everybody else and do the work. Unstable vehicle, if any vehicle is unstable, that is if the for a four-wheeler, if only two wheels or three wheels are touching the floor, then it is unstable. So we have to be very careful. We should not get caught up in the behind below the vehicle. Hazardous materials, we have to expect whether it can be present in that place. So based on that, we have to make the decisions. We have to use appropriate protective clothing, gloves, goggles, helmet or boots. Unnecessary protective clothing is not needed. What are the necessary things we have to take along to for our safety? Only we should put it. We should not look like astronauts. Next, gaining access. How to go from simple steps to complex steps. Gaining access is the next point. We have to check for open windows, doors. If a window is open, we can cut through the screen. If no windows are open, break smallest through which access can be obtained. We have to break the smallest window. In an upright vehicle, we can enter through the door. While opening, we should make sure whether the patient is if the door is locked, ask the patient to open the door. If the door cannot be opened, break the furthest window from the patient to gain access. Vehicle on side, stabilize the vehicle, enter through the top door. If door will not open, break the rear window. Through the rear window, we can extricate the patient. Gaining access, break in that vehicle upside down, gain access through the window. Doors may be supporting the vehicle, so maybe we can use the windows, break the windows, and we can reach the patient. Glass can be broken quickly and effectively with a sharp blow to the corner of a window, about 2 inches from the edge of the glass. Check whether the patient in hypoxia or shock. We cannot give oxygenation during this time, so we have to extricate the patient first. We have to take the patient out and put the patient in a long board with the head blocks so that spinal injury cannot be worsened if spinal injury is expected. Next is if the patient was fixed with the vehicle, we have to release the patient. This is called disentanglement. Remove vehicle from the patient, not patient from the vehicle. We have to cut the rods or heavy metals so that we can extricate the patient.
Thank you, Jesus.
Monitor condition. Ensure that attack on vehicle does not endanger the patient. We should not injure the patient while extricating. So you have to do this carefully using proper instruments. Do not do anything very fast. We do something urgent, we may cause damage to the patient's body. Protect patient at all times. We have to, if the patient is in a cold condition, we can use blankets, and we have to reduce the anxiety by talking to the patient and explain the patient what is happening. We should give a comfortable environment while extricating the patient. We have to stop all the bleedings, provide proper dressing for the injuries, and we have to take the patient to the ambulance or emergency vehicle. We can stabilize the lower extremity by securing it to the other extremity. If one leg is broken, we can wrap the gauze roll with the other extremity so that it will be stabilized. If an upper extremity like hands are broken, we can use gauze to stabilize the area with the body by rolling it over the body. For head, we can use head blocks, which can be used in the long board. Do not completely wrap the patient in gauze. The main point is through the door if vehicle is upright, through the roof if vehicle is on side, through window if vehicle is overturned. Successful rescue are based on planning practice. Know what community target hazards, have plan for managing them, know who you will be working with, train with them, know what kind of help are available. Do not be afraid to call for help. First we have to know what and all accidents can happen, and you have to be ready with all those things like saw or cutting devices. These and all we should know how to handle, and we should keep it handling the vehicle also, so that we can give proper care and extricate the patient from the accident spot. Thank you. Check whether the patient in hypoxia or shock. We cannot give oxygenation during this time, so we have to extricate the patient first. We have to take the patient out and put the patient in a long board with the head blocks, so that spinal injury cannot be worsened if spinal injury is expected. Next is if the patient was fixed with the vehicle, we have to release the patient. This is called disentanglement. Remove vehicle from the patient, not patient from the vehicle. We have to cut the rods or heavy metals, so that we can extricate the patient. Monitor condition. Ensure that attack on vehicle does not endanger the patient. We should not injure the patient while extricating. So we have to do this carefully using proper instruments. Do not do anything very fast. We do something urgent, we may cause damage to the patient body. Protect patient at all times. We have to, if the patient is in a cold condition, we can use blankets. And we have to reduce the anxiety by talking to the patient and explain the patient what is happening. We should give a comfortable environment while extricating the patient. We have to stop all the bleedings by proper dressing for the injuries, and we have to take the patient to the ambulance or emergency vehicle. We can stabilize the lower extremity by securing it to the other extremity. If one leg is broken, we can wrap the glass roll with the other extremity, so that it will be stabilized. If upper extremity like hands are broken, we can use gauze to stabilize the area with the body by rolling it over the body. For head, we can use head blocks, which can be fixed in the long board. Do not completely wrap the patient in gauze. The main points is through the door if vehicle is upright, through the roof if vehicle is on side, through window if vehicle is overturned. Successful rescue are based on planning practice. Know what community target results. Have plan for managing them. Know
Nanni Nanni Esapa, Kodi Kodi, Niyadapa.
Know what kind of help are
Esapa, Esapa, Raji Raji Esapa, Kodi Kodi Raji Radapa.
Know what and all accidents can happen.
Esapa,
You have to be ready with all those things.
Esapa, Esapa, Nanni Nanni Esapa, Kodi Kodi Raji Radapa.
Cutting devices. These and all we should know how to handle, and we should keep it handy in the vehicle also, so that we can give proper care and extricate the patient from the accident spot. Thank you.